We ready? Thank you for being here today. I appreciate it. I'm here today to update Nevadans on our progress and status under Phase 2 of our phased reopening plan in response to COVID-19 as set forth in Nevada United Roadmap to Recovery. I'm joined today by Caleb Cage, the Nevada COVID-19 Response Director, and Julia Peak, the Deputy Administrator for Community Health Services in the Department of Health and Human Services Division of Public and Behavioral Health. In this role, Ms. Peak is helping lead Nevada's statewide contact tracing efforts. I want to thank them and our public health and emergency response teams across the state for their tireless work on behalf of Nevada. The recent press conferences hosted by these individuals are incredibly helpful in giving updates to Nevadans on all the hard work going on to respond to the ongoing threat of COVID-19 and to build public health infrastructure necessary to respond into the future. Mr. Cage and Ms. Peak are here if needed to assist and to answer any specific questions that may arise from members of the media, but today, as your governor, I wanted to personally talk to Nevadans about our current COVID-19 situation and where we are today. I know many of you have been tracking the virus throughout each phase of our reopening, just as I have on a daily basis. Recently, we've experienced some trends that require additional evaluation and analysis. These include an upward trend in the number of new daily cases in the last 3 weeks. Yes, our testing has increased significantly, and while our cumulative positivity rate is holding steady or continues to decline, with today's cumulative positivity rate at 5.2%, the 7-day average percentage of positive results is increasing. Today we saw a lower number of cases than has been reported over the last few days. However, it is too early to tell if the previous increase or yesterday's decrease is due to a change in trend. And to summarize, we need to make sure we allow ourselves the ability and time to continue evaluating our situation. Additionally, there has been a consistent increase in confirmed hospitalizations since June 5th. The Nevada Hospital Association indicates that we are still in the plateau range of between 372 and 340 confirmed and suspected cases in hospitals statewide. This indicates that the increased number of cases in the community has not manifested in a serious disease at this point that requires hospitalization. However, this must be very closely monitored. There's a lot of information out there and a lot of numbers, so it's best to summarize as follows. We had the expectation that as a result of reopening and an increase in testing, our positive cases were likely to increase. We have seen an increase in positive cases, but that has yet to negatively impact the capacity of our hospitals. We're taking this seriously, as we have all along, and will allow our medical experts the time to monitor and make assessments. When I rolled out the Nevada United Roadmap to Recovery, one of the guiding principles that I included for decision-making was this: that states' management of the recovery and reopening process must remain flexible at all times, with ongoing monitoring of local and statewide data, reporting, and analysis. The state must maintain the ability to track warning signs in order to prevent an avoidable spread of the virus through intervention. We included flexibility as one of our core principles, then to account for the situation that we are in right now. In late May, when I signed the Phase 2 reopening directive, I set the directive to extend until June 30th to give Nevada plenty of time to watch the data and make responsible, medically driven decisions in the best interest of Nevadans on any future phased reopening. I said I would evaluate 2 to 3 weeks worth of data in making decisions on moving forward, or if necessary, pausing to determine if Nevada is still moving in the right direction. On Friday, we hit 2 weeks since Phase 2 officially began, and this Thursday will mark 2 weeks since gaming properties in Nevada were able to reopen with social distancing conditions and other restrictions set out by the Gaming Control Board in line with the state standards. Before expanding our reopening and entering a phase 3, we must continue to allow ourselves the time to evaluate this new medical information along with the impact of reopening to make sure we're doing all we can to protect ourselves and the capacity of our healthcare system to respond to the virus. As the governor of our neighboring state of Utah said late last week, we don't want to go forward and then take a step backward. As I've said before, the virus is what drives the timeline. We were able to enter phase 1 and phase 2 because Nevadans were staying home as much as possible and generally wearing face coverings, washing hands frequently, and maintaining 6 feet of social distancing. Now is not the time to abandon these protective measures. It is a time to double down on them. We can only stay open if we stay safe. I know there are a lot of theories or ideas behind what's driving the increase in cases, whether it comes from reopening businesses, increasing the limits on the size of public gatherings, the recent protests, or reopening of gaming. But we need to allow our expanded contact tracing system time to assess where these new cases may have originated. Contact tracing will help us identify a targeted response to address any increase in cases at the source. This weekend, we tripled the capacity for our contact tracing. Contact tracers are working 12 hours a day, 7 days a week, contacting people who have tested positive for COVID, asking about who they may have come in close contact with, and following up with those contacts to ensure they get the care that they may need. This well-established public health strategy of early detection, tracing, and investigating positive cases, along with the data on cases and hospitalizations, will help inform us and empower us to act in ways that protect the public from this virus. We know from the latest recommendations from the CDC that large gatherings carry a greater risk for spreading this virus, and wearing a face covering in large gatherings helps reduce the risk of spreading this virus. Please also try to maintain at least 6 feet of social distancing and practice proper hand hygiene as much as possible. Across the country, states know that with reopening at any pace comes a risk of community spread and increased cases. Nevada is no different. While you continue to do this, we will continue to evaluate data, listen to the medical community, monitor new developments, and determine next steps each day. As a reminder, the Nevada United Roadmap to Recovery Plan is federally supported, state-managed, and locally executed. Our local governments are empowered to do what they do best, respond to the situation in their respective communities. Recently, some of our local leaders and health officials have expressed concern about increasing case numbers in or around their specific communities. I want to remind these local leaders, you may use the existing authority set forth in my reopening emergency directives to implement stricter standards than those that have been set forth by the state if you feel it's in the best interest of your area. I will stand by and support each locality that makes a decision to tighten restrictions and keep residents healthy. We can maintain a statewide shared goal of keeping Nevadans and visitors safe while we restart our economy, and we can protect our communities that need it the most. Thank you. And I, along with Mr. Cage and Ms. Peak, will now be able to answer a few questions that the media might have. Want to come up and... Hey, Bill, how are you doing? How's your ankle? Okay?
It's doing well.
Good, good.
Okay, nice to see you. So I wanted to be clear, we're not ready to go to phase 3 then, is that correct? And is there a timeline at this point?
Yes, we are not ready to go into phase 3, and the timeline will be dictated by the virus. As we analyze the statistics and the data, many times a day, I analyze this data and get updated data, and we'll have to keep looking at the data to determine when it would be appropriate.
Okay, and for any of the panelists, the data we're looking at in addition to hospitalizations, again, is the increase, potential increase in the day-to-day caseload? Is there one criteria that's really standing out for the?
No, there's several criteria, and then I'll let my colleagues here answer as well. We look at the percentage positive on an ongoing basis, both cumulatively in the last 7 days. We look at the surge capacity that might be available in the hospitals that are necessary if we do have a surge. We look at ventilator usage that's moving forward. We look at PPE stock on hand in all the hospitals, and that's all fine, but those are the things that we look at, and we're going to be looking at the contact tracing that you're going to be hearing more about, or you can ask about to determine where this is originating from. So I don't know if either one of you have got something to add.
Thank you, Governor. Caleb Cage. I'll just add that in addition to those metrics, we're also looking at specific outbreaks throughout the state that may happen and how we're responding to them, how quickly they're being reported. And we're looking at the number of tests that are going on and our cumulative positivity rate, as well as our last 7 days. So it's a complex mix of metrics that are helping us to determine where we are in this phase process.
The only thing I would add is that we have added questions to our core set of case investigation related to, have you been to a casino? Have you been to a social event? If so, which social event? So we'll be able to pull that more rapidly and analyze that data in more real time.
Hey, Governor. Last time we talked about this, you said you didn't want to impose any sort of mask requirements on customers of businesses because you were concerned about people taking it out on employees. Right. Have you at this point considered going back on that and potentially imposing any sort of mask requirements?
Well, I wouldn't necessarily call it going back on that. We are looking at any options we might have available. If it comes up through what Julie had just previously mentioned, that one particular business type has got a problem, that there's a spread in a particular business, we might look at doing something in that area. If we come up with a situation that we can pinpoint that there's been a spread or a breakout because of a certain activity or a certain event or a certain location, those are the kind of things we could look at. I know that the chair of the Gaming Control Board is doing a tremendous job. I'm really proud of her, and she's been leading the forefront. I deal with the gaming properties on a regular basis. I mean, they are going out of their way. The employees are all wearing masks, and they're going out of their way to encourage the customers to wear masks. They're even offering incentives to get the customers to wear masks. And some of them are more successful than others, but we're going to continue to pursue it as much as we can right now on a voluntary basis.
So we're also not moving to phase 3 right away. What does this mean for the emergency directive that's currently in place, and specifically the eviction moratorium that is going through the 30th? Yeah,
the eviction moratorium we're looking at, we're analyzing that. I met on that a little bit this afternoon. We will have another announcement before June 30th as it relates to any the directive.
So maybe an extension?
We'll have another announcement before June 30th, whatever that might be.
Hi, Governor. Thanks for doing this. So today, the Southern Nevada Health District and the Gaming Control Board issued somewhat divergent statements, with the Health District saying that urging heavily businesses to mandate masks, and the Gaming Control Board saying that they would only encourage mask use. I'm wondering if there's a benchmark or kind of point that you think the state should step in and adjudicate that disagreement.
Well, I have complete faith in the chair of the Gaming Control Board, Senator Douglas Morgan. I've got faith in our properties that are there. I can tell you, I speak to the properties, I speak to the management. They're doing everything they possibly can to encourage people to wear masks. Now, if in fact, as Julie has explained with the contact tracing, we show that there's a problem in the casinos and we have information or evidence that they're not wearing masks, that's something we would have to consider in working with the health district. I don't want to go there if we don't have to. You know, I'm encouraging people to voluntarily wear masks. I hear and I see in some of the articles, and not by anybody here or anybody that's making a comment, said in this post-COVID era we're living in this post-COVID time. We're not in the post-COVID time. We're in the middle of a COVID-19 pandemic. We're right dead smack in the middle of it. And I do not want to lose. Nevadans have made enormous sacrifices to get us to where we're at today. Enormous sacrifices. They've stayed away from their families, their extended families. They haven't been able to go out to eat as much as they might have wanted to. They've avoided group gatherings and so forth. They've social distanced. They've practiced good hygiene. They've worn facial coverings. I don't want to let that all go for naught by us having to take a giant step backwards. So I'm encouraging people to double down, as I said, on those efforts and make sure that we can continue to move forward, although it might be at a little slower pace.
So states like we're in Nevada. States like Arizona and Utah have seen an uptick in numbers. Have you or anyone here thought about that as you consider how to advance along Nevada's phased reopening plan?
Oh, I think about that on a daily basis. I was on a governor's call this morning with the vice president. And, these are issues that come up when you have outbreaks in bordering states and how you deal with that. My chief of staff has been in regular contact with the Western States Compact that we're part of that basically surround us, most of them do, to determine what they're doing. And, this virus doesn't recognize borders. It doesn't stop at the California-Nevada border or the Colorado-Nevada border. It just doesn't. It doesn't stop when you hit the Arizona state line. We are well aware of what they're doing. We're in coordination with them as much as possible, but what they feel is in their best interest might not be the same for Nevada, and we're analyzing it on a daily basis.
Thank you.
Thank you.
Hi.
Hi.
So one of the benchmarks for Phase 1 and Phase 2 was protecting vulnerable populations. However, in Washoe County, there have been 40 deaths of residents and 2 staff members, and there's only 71 deaths in Washoe County, so that counts for 59%. And a few of those deaths, a lot of those deaths were during Phase 2. So I'm just curious, what does protecting vulnerable populations look like? Is that happening?
Yeah, protecting vulnerable populations is extremely important to us. We set out on an effort to, and Caleb can jump in here, to test all the nursing homes. I think we've gotten through them all, haven't we? You want to?
Yes, sir. So the significance of testing vulnerable or protecting vulnerable populations has been a part of the Nevada United plan that you referenced a moment ago in our ongoing efforts, and it's a part of our strategic plan that Julia and I unveiled about 2 weeks ago as well. And it's from the state level, getting back to the governor's point in his remarks a few minutes ago, all disasters, including a global pandemic like this, are federally supported, state managed, and locally executed. The federal and state governments have been working from a licensure and regulatory standpoint with the skilled nursing facilities in the state, as well as to make sure that we're going beyond just the skilled nursing facilities and making sure we're testing, but also making sure that they have the personal protective equipment that they need in those homes, and making sure that their staff are tested and otherwise. So there are a number of efforts that are underway right now to do that. And I would say outside of the skilled nursing facilities, assisted living programs or assisted living facilities, as well as people who are in remote and rural areas in the state have bigger challenges in getting to tests, but also to medical care as well. So all of those are part of the overall strategy to make sure that we can reopen responsibly and stay open.
And with those things, I guess, why are deaths still occurring, and how often are residents and staff getting tested at state-regulated facilities?
Thank you for the question. I think why are those deaths occurring? I think if you, not to minimize, and nor would any of us ever minimize this, this is tragedy for all of the families of those who are involved. But if you look at the populations that COVID-19 has the most dramatic impact upon, it's your older population, and it's your population that has underlying conditions and people who need skilled nursing care and skilled nursing facility, often overline. That's happening around the country. I'd like to see if Julia has anything to add to this from a public health standpoint. It's happening around the country, and that's why we've made it one of the 5 criteria as protecting vulnerable populations here in the state of Nevada.
I would just add that since the beginning of the pandemic, and in Nevada, we have developed strike teams. So we have environmental health specialists, epidemiologists, and health facility inspectors, as the director mentioned, addressing each facility, and are assigned to a facility and walk them through that process throughout. So I do want to acknowledge our team that's really been working hard with that population.
Got it. Sorry, one last question. With all these steps, do you feel that these populations are being protected?
We're doing everything we can to protect them as much as humanly possible. Unfortunately, there is no absolute surefire way. We've protected them in terms of providing proper PPE. Staff and residents are getting tested. We've limited visitation and doing what we can to protect all of those folks that are living in those facilities.
At Arbor's Memory Care, they're supposed to get volunteers from the Battle Corps volunteer initiative that you had. They were only sent one. Why did that happen?
Because I think, if I'm not mistaken, at the time they asked for one, and that's what we sent.
Okay, thank you.
Thank you.
Thank you for taking my question, Governor. You recently suggested, and it was approved by the legislature, cuts in the spending of $116 million to help to fill the gap created by COVID-19 impacts. Even with more federal stimulus and the use of $400 million from the rainy day fund, we would still be short of budget. Will there be remaining? Where will those remaining funds come from? Can we expect job cuts? Will there be a raise in taxes?
Well, we released a plan last week, some of our proposal as it relates to the cuts that are necessary, and they are severe, the cuts that are necessary. We think we did the best we possibly could. Originally we're looking at almost 500 layoffs. We got it down to under 50. We've frozen merit pay for the next fiscal year. We've got everybody on 1-day furlough per month for the next fiscal year. We're keeping positions open as long as possible, and we're going to work with the legislature to come up with a budget moving forward, but we had to take some pretty significant cuts to balance the budget.
Does getting to that final budget include any job cuts furthermore, or raising taxes with maybe a special session?
Well, there's going to be a special session. There's going to be a special session. It's just a matter of when. Hopefully, it'll be in this fiscal year, so we've got 15 days left, I guess, to have one. We've got, like I say, it's a little less than 50 layoffs currently, and we're going to have to work with legislature in order to balance the next budget. So we've got a lot of work ahead of us.
Last question for me. You've mandated social distancing for no more than 50 people in large venues such as churches, but in the last couple weeks, we've seen protests, demonstrations, and up here in Reno, as you saw, and down in South Nevada as well. Hundreds of people marching together, sometimes thousands of people. Some don't have masks on, some do. But in that situation, what is your opinion of these protests from a purely health concern? Not something you like to see, and if it is something you like to see, does that contradict your mandate about churches?
Well, no, I don't think it contradicts my mandate at all. Churches are a different situation, and I'm dealing as much as we possibly can with the church leaders. They're an indoor facility, which makes it a little more impactful than it is outside. And that's one of the things that Julie is working on, where the protests are a big concern. I mean, the protests I support everyone's ability and right to protest and getting involved, and I think that's a fabulous thing to do. When I look at them and I see a lot of coverage on TV, and it troubles me when I don't see people wearing masks. I know it's hard to protest with everybody 6 feet apart. That's not a realistic expectation. But I would certainly hope that they would distance themselves as much as possible, and without a doubt wear face coverings. And we will see as we move forward with the contact tracing if this surge in cases is a result of people that had gone to protest, or that they'd gone to another event, or whatever it might be. They went to a casino, and we'll get that information in the days ahead.
Perfect. Thank you so much.
Thank you.
Time for just a couple more questions, so we'll do the next.
Hi, Governor. Can you rule out raising taxes in this forthcoming special session?
It's going to depend what the legislature is going to have an awful lot to do with that, what they decide, how they decide to move forward. We are clearly in an extremely difficult position. We're short $800 some odd million, that we're going to have to come up with, and it's going to be done through a combination of the revenue side and the expense side, and I don't know what appetite there is there. I know it's difficult for me to even think about raising taxes when I've got families that are still unemployed. They're still waiting to get back to work, and don't want to impact those at all, but it's going to depend what the legislature comes up with, and hopefully they're willing to all sit down and come up with a positive solution, and that coupled with what help we might get from the federal government.
So you're not saying absolutely no in this coming session?
And I'm to be real honest with you, I'm difficult to say absolutely no that tomorrow's Tuesday. I mean, things have changed so rapidly. When I got into this year, I was talking to my staff about it today, 70 days ago, thereabouts, we closed the casinos. It seems like 5 years ago to me. It seems like an eternity that we've been living under this. I don't know what's going to happen in a special session, what their leadership is going to be willing or looking to do. I mean, I don't have the final say-so in how this is all done. I'll work with them, and hopefully we can come up with a compromise that'll suit everybody, that we can protect our residents, and we can continue to provide services for our residents at the same time, not burdening them unnecessarily.
The Pardons Board is going to be meeting on Wednesday. One of the agenda items is discussing potentially doing something more than what the Nevada Sentencing Commission recommended to you. Are you going to propose any specific measure that would do something more broad about reducing the prison population?
Well, I got my Pardons Board briefing today, and that was one of the topics that was brought up. I was a little surprised when I heard that proposal was going to cover a handful, I mean like 5, 6 people. I don't know, here again, that's not something that I can do by myself. I'm anxious to see what the Pardons Board feels about this. I'm honored to be on there with, I'm the only non-lawyer that's there, I think. So they know the law, and I would like to get vulnerable people in a safer environment if I had my way. Now, how we can do that and how quickly we can do that, I don't know, but it's definitely something that we'll have a discussion about.
Are you bringing any specific proposals to the table on Wednesday?
I am not about that one yet. I'm bringing the discussion forward on that, and how we will be able to deal with it is how it remains, what everyone will come up with.
Okay, and then you said yesterday that you want to see an investigation into the use of non-lethal projectiles and other arrests and force of legal observers
Right.
at the Las Vegas protests. Do you trust Metro to carry out that investigation, or does some independent body need to get involved?
Well, I do trust Metro. I'm unique. I'm the only governor in the country that spent all this time as a county commissioner and spent 10 years and 6 years as the chair, and I've worked with the sheriff and Metro. I'm troubled by what some of the reports were. My understanding is Metro is undergoing an investigation as it relates to that situation specifically with the legal observers and what their position was at the time, what happened and what didn't happen, and hopefully they can come up with a conclusion that'll satisfy everybody.
Does some independent body need to get involved?
I think it takes a lot longer. Hopefully Metro will come up with something, and then if people aren't satisfied with what happens, I guess we could look at other alternatives, whatever that might be. But when you get into other bodies, then you get into who that body would be or who that entity would be and how you would go about doing that and how long that might take. And hopefully this can be done quickly, and they will see should be a lot of body camera footage, see what happened and be able to come up with a responsible answer to what transpired.
Okay, thank you.
Thank you.
And this will be the last question, Governor.
I only have 10 or 12, so.
Good. She's cutting you guys off early today. I don't know.
Right. CARES Act funding, I want to see if you can weigh in on what's going on in Clark County. There are communities there who feel like they haven't gotten their share. Should Clark County be funding those from their $295 million distribution? Can the state get involved with anything, try to sort that out?
Yeah. That was 2 years ago. You could have asked me that question when I was the chair of the commission. I had a better answer for you, Bill. We were, as a state, there were 3 buckets of money. You know that the state got its money. There was money set aside for Clark and the city of Las Vegas, and there was money set aside for the other 16 counties. Now, we made the phone calls, we made the disbursements for the other 16 counties last week, and I made those calls, and it was very well received when I got to call commissioners or mayors or city managers and tell them, you're getting $8 million, you're getting $20 million, and they were happy to hear from me. The situation in southern Nevada is the 2 entities that had over 500,000 were the city of Las Vegas and Clark County. Now, I can tell you as chair of the Clark County Commission when I was there, and Marilyn Kirkpatrick is there now, and she's facing what I dealt with, they deal with a lot of entire population Southern Nevada services, the hospital and the court system and so forth and so on. How they distribute the money is the federal government came up with this plan. This was not a state plan. Mm-hmm. The federal government said the city shall get so much, the county shall get so much, and those other cities under Clark County were kind of left out of it. Now, they will get reimbursement, my understanding, for some of the expenses they made. Is that fair? I don't want to weigh in on that. I've got other elected officials that's going to be their responsibility. I know they're talking, and I'm hopeful that they'll be able to come up with something that satisfies everybody.
Okay, and then just briefly, the special session, within the next 2 weeks, how's that gonna work logistically? Are lawmakers gonna come back?
Yes, if we have a special session, it'll be an in-person special session.
If we have, but, so it's not.
No, we're having one.
Okay, thanks.
I don't know the date, but we're having one, and they will come back up here. And they will be socially distanced in the building.
Thank you.
Thank you.
Thank you all.
Is that it? Thanks, everybody. Appreciate you.